The pre-takeoff phase is the first step the learner must accomplish. This is where they mentally prepare by visualizing the movements needed to make up the back tuck. Also, if the learner is being taught inside, they must spot a point higher than eye level to know when to tuck their legs in. For example, they can spot the ceiling. The learner must be in normal standing posture and then shift the weight to the balls of their feet. Once the learner is mentally prepared, they're able to enter the takeoff phase. With the weight shifted to the balls of their feet, the learner starts with their hands in front of them, flexing the glenoid humeral joint between 90 and 180 degrees. Their iliacus, psoas, rectus femoris, sartorius, tensor fasciae latae, biceps femoris, semitendinosus, and semimembranosus all flex, allowing a slight bend in the hip and knee. Through reciprocal inhibition, this allows vastus medialis, vastus intermedius, and vastus lateralis to be stretched, creating an internal moment of muscle force. As the learner flexes these muscles, they must simultaneously extend the glenohumeral joint. This is done by flexing triceps brachii, anconeus, latissimus dorsi, teres major, and posterior deltoid. The flight phase begins immediately after extension of the glenoid humeral joint. The learner must quickly flex the glenoid humeral joint to 180 degrees by activating anterior deltoid, clavicular head pectoralis major, and coracobrachialis. The torque produced in the lower limbs during the takeoff phase must generate enough force to project the learner off the ground and into the air during the flight phase. As the upper limbs flex, it allows momentum to take them higher. This is when the visual sense of spotting something higher than their eyes at standing level comes into play. After the learner begins to take flight, they must slightly throw their head back. This is done by activating erector spinae, allowing extension in the cervical spine, so their learner can see the visual spot of the ceiling that they originally imaged in the pre-takeoff phase. By doing this while they jump and raise their arms, it causes their center of gravity to raise up as well. When the learner begins to see the ceiling, they use rectus abdominis, internal obliques, external obliques, iliacus, psoas, rectus femoris, biceps femoris, semitendinosus, and semimembranosus to flex both hips and knees, bringing them in towards the center. This causes rotation, and while the learner is tucking their legs in, the glenoid humeral joint is still flexed, allowing them to grab the posterior distal femur or on their anterior proximal tibia, thus creating the tuck position. The landing phase is where the learner is mid-flight and has their legs over their head. As they continue to rotate, the learner starts to extend their knees by activating rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis to prepare for landing. When the learner's feet touch the ground, they will try to land on the balls of their feet again, and flex their knees slightly by activating biceps femoris, semitendinosus, and semimembranosus to absorb the shock of the ground force reaction. For this skill to be graded as successful, the learner must not move any body part after landing, which may be difficult if the steps are not followed adequately. We may not always think about every detail that we need to accomplish to produce a proper form of the movement we desire. However, in the world of gymnastics, if you make an error, it could be dangerous. When performing a standing back tuck somersault, there are a few errors that could happen and lead to more problems in performing the movement. For example, keeping your head and neck straight. Generally, you begin learning the skill on a trampoline, and when you do this, you keep your head and neck straight. The trampoline teaches and gives you the height and time you need to be able to tuck your legs in and rotate over slowly. The only problem is when you do this on the ground, you do not go as high as you did on the trampoline, and the entire process is sped up. This causes the learner to under-rotate and decreases the likelihood of landing. This can be dangerous to the learner because there is a chance of landing on their knees or even worse, their head. This could lead to a multitude of injuries down the road, including but not limited to paralysis. A strategy to fix this problem is teaching the learner to extend their neck back as they jump. It will create a parabola and increase the time in flight. Therefore, as long as the learner generates a powerful torque causing hip and knee flexion, they will rotate fast enough and land. In conclusion, the learner must complete these steps to accomplish a standing back tuck somersault successfully. First, in the pre-takeoff phase, you must mentally prepare. Visually spot the ceiling and have your glenoid humeral joint flexed between 90 and 180 degrees. Then in the takeoff phase, you flex your hip and knee as you swing and extend your glenoid humeral joint back, allowing for a stretch in the quadricep and anterior upper limb muscles. After the stretch, you enter the flight phase, where you press off the balls of your feet and jump into the air by flexing your glenoid humeral joint to 180 degrees, while you extend your cervical spine back. While in mid-air, you flex your hips and knees while the glenoid humeral joint is already flexed, creating a tuck position. This allows for a quick rotation. Then in the landing phase, the learner begins to extend their knees slightly to anticipate the landing. After they touch the ground, they slightly flex their knees again to absorb shock. Although there are problems that may occur, if the learner is taught in progressions like this, it may decrease the likelihood of injury. When teaching the learner, it is important to emphasize that it is not as important to go high up in the air as it is to rotate fast while you're in it.